Amplifying. So I'm Dr. Sona, and I'm the director of Pari Foundation. Stress, a very common attitude that we all face. It's seen everywhere. Stress has been an epidemic now. It's taking a pandemic, it's spreading world over. Are we stressed? We need to look into ourselves and find out. What exactly is stress? Stress is a highly subjective phenomenon and it defies all definition. The term stress, as it is currently used, was coined by Hans Seil in 1936. Millions of people are suffering from stress each year, and about 3 to 4 people say that they experience stress at least twice a month, and these very people say that they suffer from high levels of stress at least twice a month. Stress can lead to contribute to heart disease, high blood pressure, strokes. It can lead to alcoholism, obesity, drug addiction, cigarette smoking, depression, and other harmful behavior. In the last 20 years, it has been seen that the number of people who have been reporting that stress affects their work has gone up more than 4 times. And this is causing a lot of concern. A nationwide survey was done and about 2,500 adults were surveyed, and the following culprits were found for stress. Too many responsibilities, finances, work pressures, personal health difficulties, as well as health problems in the family. These are the commonly cited ones amongst the many more. One aspect which the study related to was that this stress was affecting the people's behavior. And people who had been reporting to be under stress were having a lot of difficulty in sleeping. They were eating less, they were exercising less, amongst the other things which we will be gradually coming to. There's no denying that stress will always be a part of our lives. Stress hits each of us differently. Some of us feel it in our bodies, and some of us just can't stop worrying. Knowing how you experience your stress can help you find the most effective methods to relax yourself. Sometime back, we called the kind of stress that we express in our bodies as somatic stress, and this registered as butterflies in our stomach, as indigestion, a racing heart, or jitters. But some people were more prone to experience stress mentally, and this was called cognitive stress, and they ended up into worrying and into having anxiety and depression. There are many related problems to stress. It causes depression, it causes suicide, it causes drug abuse, child sexual abuse, psychosomatic problems, somatoform problems commonly known as hysteria, and very risky adolescent behaviors, and these are all the factors which we are taking up in Pari Foundation. Now, people are viewing stress as something which is very unpleasant. So Seil subsequently thought of a new word, a stressor, and he said that it is a stimulus and a response effect. That means the stressor, the stimulus, is outside us. It is something, it's an exam, it's a test, it's an interview, something which is beyond us. But our thoughts, our cognitions, our perceptions, our beliefs lead us into causing the response, the worry, the stress inside us. And some people describe stress as a physical, mental, or emotional strain of tension. And some said it was a condition or a feeling experience when a person perceives that demands exceeds the personal and social resources that the individual is mobilizing, and therefore stress had been always been viewed as in a negative light, and its positive effects were ignored. But let me bring to your notice that stress can be helpful, it can be good, and it can motivate people to accomplish more as well. This Seil called eustress, good stress or eustress, and it's a short-term stress. It's something because this stress releases some hormones into our body, and these hormones energize us, give us more strength to act upon the important job or the presentation or the interview or the sporting event which we are going to face. And this is enhancing, this is motivating, this is eustress, and this is good. good stress, the fight or the flight stress. The human function curve very well depicts how this eustress can and does turn into distress, which is damaging. As illustrated in the left, the increased stress levels results into increased productivity, but up to a point, the hump, after which things suddenly start going downhill. That point or that peak is different for each one of us. So each one of us needs to be sensitive to our very early warning symptoms and signs that suggest that there is a stress overload and it's starting to push us steadily down the hill, down the hump, into distress. Distress, it's an extreme stress, long-term stress or chronic stress, and your body will eventually wear itself off. It's due to constant worry over your job, over your school, over your family, never-ending worry, no solutions to the problems which face you. It drains all your energy and your ability to perform well. And this is one of the worst things we can do by subjecting our minds and body to this constant, chronic, debilitating stress. Stress has so many warning signs and symptoms. It has cognitive symptoms, the distress. We have memory problems, there is an inability to concentrate, poor judgment. We start seeing things in the negative. We have anxious or racing thoughts, and we have constant worry. We have emotional symptoms. We are moody, irritable, short-tempered, agitated, aggressive, overwhelmed, lonely, isolated, depressed, or there's general unhappiness. We have physical symptoms like aches, pains, diarrhea, constipation, nausea, vomiting, chest pain, a loss of sex drive, frequent colds, and the very important behavioral problems. We eat less, we sleep less or more. We isolate ourselves from others. We start procrastinating or neglecting responsibilities. We use alcohol, cigarettes, drugs to relax, which are so much more damaging and lead to more stress. And we have nervous habits like nail biting, pacing, or itching. Now, all this is related to the brain. And we have to understand that the brain structure, while it's developing in the infant, or while it's growing up in the adult or in the age, people are aging, is related to age-related changes, which are so very vulnerable to the effects of stress. And they are vulnerable to the effects of stress because it is actually the HPA axis, the hypothalamus pituitary and axis from the brain, which leads to the adrenals, which are small glands over the kidneys, and the adrenals then result into the production of glucocorticoids, and these glucocorticoids or the stress hormones are essential for normal brain maturation, and if these glucocorticoid levels are skewed in any way, they impair maturation and the survival of different brain cells is damaged, and this results into overall cognitive and behavioral defects. Prenatal and postnatal stress is so very important. Prenatal stress is before the infant is born. Now, the very many causes of prenatal stress is maternal depression, intrauterine undergrowth, and low birth weight babies. If this is so, they are indices that there has been prenatal stress, that the mother has been in stress while she was pregnant. And the negative effects of these prenatal stress, they damage the child in such a way that it leads to many behavioral and neurological and cognitive disturbances in the child, which leads to children being unsocial, showing inconsiderate behavior later when they grow up, being ADHD, attention deficit hyperactive disorder, having sleep disturbances, as well as so many psychiatric disorders like depression, anxiety, and mood disorders. But the good point is that quality postnatal care, that means care by the mother after the child has been born, by the parents, often moderates these negative effects. There is postnatal stress also, which is very damaging, and this is due to, after the child is born, this is due to low social economic strata, or maybe maltreatment, sexual abuse, war. All these have some adverse effects on the brain of the child. Adolescent stress is also very important, and we have to keep in mind that it is the frontal cortex of the brain which undergoes major development during adolescence. And we have to keep in mind that adolescents who are exposed to early postnatal stress are at higher risk of developing depression. We also have to keep in mind that stress during adolescence leads to many psychopathologies and psychiatric problems. Adulthood and old age problems are also very relevant. Increased glucocorticoid levels due to stress damages the brain, which is very vulnerable at this time, and it is the frontal and hippocampal lobes which leads to cognitive impairments. What is adrenal exhaustion? It is something which is so very common nowadays. It's one of the most common but the overlooked health problems nowadays. Actually, it is the adrenal which leads to glucocorticoids secretion in the body, which are the stress hormones which counters the stress in the body. But it has been seen that over the time, due to an excessive stress overload, the adrenals are getting overworked and they cannot handle the amount of stress which is being put on them. As such, they are going into damage, they are going into exhaustion, and this is leading into a lot of problem in the cognitive function and hormonal disbalance. Now just let me go back to stress. That was just a little bit of the brain functioning. A roller coaster ride is a very good example of explaining what the stress is. Stress is difficult to define, we know, but it is so different for each one of us. A roller coaster has 3 grades of people. There are some people who are sitting right in front. There are some sitting in the middle, and there are some sitting right at the back, and it's going around in full speed. Now we see that all these 3 types of people have a different experience on the roller coaster. The people right in front are so scared. They may be having hunched knuckles, they may be scared, and they may be catching on to the grip, and they can't wait for the roller coaster to stop so that they can get off and get on. There are another group of people who are enjoying the ride and they want it more and more. They're yelling and shrieking and they're going to go into another ride after the first one. These are the people who are enjoying the ride. There's a third set of people who are hardly bothered. They are unconcerned about anything, as if they are very bored about the whole thing. 3 sets of people. The roller coaster is the same. Is the roller coaster causing the stress in them or not causing the stress in them? No. Their control over the roller coaster is the same. It is just their perceptions, their thoughts, the way they are perceiving the whole issue, that and their expectations that are different. The coping skill of each person is different. How we cope with a problem tells us whether we land up into stress or we are de-stressed. As Eleanor Roosevelt very adequately noted, nobody can make you feel inferior without your own consent. That much about stress. Now, how do we cope with stress? We have to understand that we have individual coping mechanisms and these have to be geared up. Now, these individual coping mechanisms are 2-way. We have to look inwards and we have to be self-aware of what we are thinking, what we are feeling, our perceptions and our expectations. Our glasses may be colored, how we view a situation. It is only if we change our glasses, we change our perception, that we change the way we look at things. A glass is either half full or half empty. It is our perception of it that causes stress or does not cause stress. The second is an increased stress tolerance has to be developed, because stress day by day is piling up into our lives. We have to build up the inner resilience to face that stress, and that has so many points to it, like we should be getting up early, we should be to face the sun and feel invigorated, and we should be exercising. A simple solution is we should eat well, we should think healthy, and we should sleep healthy. We should cope with stress, as I said, with healthy coping skills. We should have some time for fun. We should prioritize our tasks. We should spend some time with positive people. Establish healthy boundaries. Remain aware of our sources of stress. Focus on what you can control and what you cannot control. Reassure yourself. Self-talk, self-counsel. Keep your problems in the right perspective. Find a technique to help you to relax. There are a lot of research has been done, and we have found mindful meditation and yoga. Now, mindful meditation is something to do with how we are meditating and being free in our thinking process, and yoga is to do with our bodies. The bottom line is that there is no single best way to get there. Each one of us has to find our own path. We have to find a technique which helps us to relax, and it is worth the effort. So you should shop around, and you should find a method that you enjoy. You should practice every day. You should find a time in your daily routine that you can set aside just for this, whether you're out on a drive or on work or at your home. Because if you develop a strong daily practice of meditation, of relaxing, of yoga, or whatever you like, you will be able to call on it and to help you calm down when you need it most. As I said, the greatest weapon against stress is our ability to choose one thought over the other. So develop your choosing skills. This is from Pari Foundation, Psychological Assistance and Rehabilitation in Children, and I am Dr. Sona Kaushal. Thank you.
Thank you so much, Dr. Sona Kaushal Gupta. I just want to speak one secret about her. She has been a wonderful friend to me. We have studied together in IT College Lucknow, and we have such a fond memories of the college as well. But she is been a wonderful secretary in Meerut, Dehradun, and she is running a Pari Foundation, which is doing a lot for the society. Thank you so much, Dr. Sona Bharti. I'll request His Excellency Ambassador from the Embassy of Palestine, Mr. Adnan, to just give a moment, token of moment to Dr. Sona Bharti. Please, sir.